Tonight, 13 Investigates has an incredible story about an Indiana woman denied coverage for life-saving medical care. That woman survived because paramedics acted quickly, but her insurance company told her everything happened too quickly. Our senior investigative reporter Bob Siegel explains what happens next and why it raises big questions about how all of our medical claims are handled.
You want a treat? You want a treat?
Amanda Boley says she had just taken her dog for a walk when her life turned upside down.
Sat down, was texting, laughing with some coworkers. My dog was acting a little weird, and I looked at her and said, "What do you want?" And I kind of played with her a little bit, and then I was gone.
And you remember nothing after that?
I remember nothing after that.
Jefferson County 911. I need an ambulance immediately.
It's October 24th. Amanda had just collapsed. And Officer Kyle Pence is first to respond. A camera on her front porch shows emergency crews rushing to help Amanda after her heart stopped. Her breathing stopped. Essentially, everything stopped.
Don't let her die. Don't let her die.
Not conscious, not breathing.
Amanda, please come back.
I did not feel a pulse while I was there.
I love you, Amanda.
Amanda was in cardiac arrest.
Stay with me.
Paramedics and doctors quickly determined the only chance to save Amanda's life was to get her to a major hospital, the closest one an hour away. So they called in this helicopter to transport Amanda to Louisville. That's where doctors implanted a defibrillator in Amanda's chest to restart her heart. She remained unconscious for 2 more days.
Next thing I know, I woke up Saturday in the hospital. I had IVs everywhere, out my neck, my arms.
Had they not flown you by helicopter,
I'd be dead.
that was truly a life-saving decision.
Yes, I'd be dead.
So imagine Amanda's surprise a few weeks later as she was reviewing all the bills paid by her insurance company to find one bill denied. It was the bill for emergency transport in that helicopter.
They were denying the claim because it didn't get pre-approved.
You heard that right. Anthem Insurance told Amanda it would not pay for the air ambulance because this service requires pre-approval. And the company said, your plan doesn't cover this service without it. You are responsible for this amount.
$64,998. I cried. I felt sick because how am I going to pay that? And then I decided, well, I'm going to look at my policy. And my policy said pre-approval may be required. And so then my thought was, dry the tears. Okay, this has definitely got to be something that doesn't need pre-approval.
So Amanda sent Anthem details and documents about her dire medical condition, all showing she was most certainly suffering from a life-threatening emergency that justified the helicopter and that rendered her unable to get pre-approval. But all that paperwork from Amanda did not work.
I appealed, and they denied, and I appealed, and they denied.
That's right. Anthem turned down her appeals, not once, but twice, keeping its previous decision and insisting Amanda's claim was processed correctly. Anthem said air ambulance services are subject to medical necessity reviews by us and will only be covered when approved in advance, before services are performed. There is no pre-authorization on file approving this service.
That night I was dead, and then I was unconscious. I don't know how I'm supposed to get pre-approval.
She was in no way, shape, or form able to call to get pre-authorization. She was unresponsive.
I don't have $65,000 laying around. I don't know many people that do, and I just think it's going to financially devastate me.
That is when Amanda called 13 Investigates, and we contacted Anthem to find out why in the world an unconscious patient in cardiac arrest would need or even be able to get pre-authorization for a life-saving helicopter ride.
Anthem would not meet with 13 News to talk about this case, but the company did send us a statement saying it completely messed up. It's a long statement, but it's important, so I want to read you most of it. Anthem says, emergency treatment never requires prior authorization, and our members can access emergency services 24/7 at any facility, regardless of network status. In this case, coverage decisions were made without the necessary information from the provider to recognize that this was an emergency. Once we became aware of the circumstances, We should have acted immediately to obtain that documentation and approve the claim, but we did not. We deeply regret the mistakes that led to the incorrect determinations, and our leadership team has been in touch with our member to offer our sincere apologies. So, that $65,000 bill, Amanda doesn't owe that anymore. But the way this case was handled raises some big concerns.
It doesn't even make sense.
Patricia Kelmar is with the U.S. Public Interest Research Group, which tracks public health issues affecting consumers. She says there are news stories every day of patients just like Amanda battling big insurance companies over improper denials.
It seems like a disconnect, and the patient is left with this huge bill. That can't be right. That's not how our system is supposed to be working with insurance.
An estimated 450 million health insurance claims are now denied each year. That number is growing, and some consumer watchdogs worry it's because decisions are being made by computers, not by people.
We know right now that insurance companies are using AI to deny claims. These are individuals who have medical records, medical histories that may not fit into an AI model. And so it's important that there's a real human being that's looking at this information and making those claim denial decisions.
Was artificial intelligence used to evaluate and repeatedly deny Amanda's claims? Or was it a human being who made those mistakes? Anthem has not responded to that question. Either way, Patricia says when medical claims are denied, patients should fight.
They should certainly appeal. What we've seen in studies is at least 50%, and there have been reports of even as high as 75% of the time, patients will win that appeal.
Oh, good girl.
Amanda says in her case, an appeal never should have been necessary.
It's appalling. It's outrageous. When people need help in a crisis situation like that, they have insurance for a reason. It's to help when those situations happen.
Following this investigation, Anthem tells me it's now revisiting staff training and what the company prints and documents to help prevent mistakes like this from happening in the future. What can you do if your claim is denied and if your appeal gets denied too? We have tips for you at WTHR.com. I'm Bob Siegel, 13 Investigates.